Hello everyone, welcome back to Viva, and in today's video we are going to talk about the parotid gland. This parotid gland is the largest salivary gland and it is pyramidal in shape. The location of parotid gland, it is present in the retromandibular fossa or the parotid bed. Now let us talk about the capsule of parotid gland. This capsule of parotid gland, it is formed by the investing layer of deep cervical fascia and it is supplied by the great auricular nerve. Remember a very important MCQ. Capsule is formed by the investing layer of deep cervical fascia and it is supplied by the great auricular nerve. And this capsule, it has two laminas, the superficial as well as the deep lamina. Let us understand these things in a diagram. See, you can clearly appreciate that the investing layer of cervical fascia, it splits as the superficial lamina and attaches to the zygomatic arch, whereas the deep lamina, it splits into two halves again. One half it thickens and attaches to the styloid process to form the stylomandibular ligament, whereas the other part it goes and attaches to the tympanic plate. So this is about the capsule of parotid gland. Now let us talk about something called as parotid swellings. These parotid swellings are caused by a virus called as mumps, so which causes the inflammation and the swelling of the parotid gland. And these parotid swellings are very much painful because there is involvement of which nerve? As discussed, there is involvement of great auricular nerve. No, the capsule it is supplied by the great auricular nerve, and the parotid gland is surrounded by the capsule. So when this parotid gland it swells or inflames, the capsule gets irritated and through greater auricular nerve we get painful sensations. So this is about the parotid swellings. Now let us talk about the external features. The external features are apex, which is directed downwards. So this is the apex, guys. And let us talk about the surfaces. We have the superior surface or the base. You can clearly appreciate the superior surface here. Don't confuse between superior surface as well as the superficial surface. Superior surface is the base. The superficial surface is the thing which we see as soon as we open the skin. See, I'll just show you in a cadaveric diagram. Suppose, think we have all the skin here. So this is all the skin. So as soon as we cut open the skin and reflect the parotid gland, so the first thing which we are going to appreciate is the the superficial surface. I'm sorry. The thing which we are going to appreciate is the superficial surface, and as the superior surface is the base. Okay, the superficial surface is present superficially, and we have anteromedial surface as well as the posteromedial surface. Okay, you can clearly see this is the posteromedial surface and this is the anteromedial surface. Now borders, see, if you don't remember surfaces also it is okay, but the borders should be remembered. Okay, we have three borders, the anterior, posterior as well as the medial. So this is all the anterior border. From the anterior border only we have the parotid duct emerging, remember. Okay, from the anterior border we have parotid duct emerging and we have posterior border. So this is all about the external features of the parotid gland. Now let us talk about the relations of the parotid gland. See, I want you guys to please visualize the relations which are present surrounding the parotid gland in our body. Okay, so first let us talk about the anteromedial relations. In the anteromedial relations, we have the ramus of mandible. Just try to visualize in your own body or in your own parotid gland. So we have the ramus of mandible. Attaching to the ramus of mandible, we have two muscles, the medial pterygoid as well as the masseter. Okay, these are the anteromedial relations. Now, what are the posteromedial relations? The posteromedial narrations, we have the styloid apparatus. The styloid apparatus is nothing but the muscles attaching to the styloid process. Okay, and we also have the mastoid process along with the two muscles, that is the posterior belly of digastric as well as the sternocleidomastoid. Remember, in the posteromedial, first we'll talk about the bony as well as the muscular relations. The two bony relations are styloid process and the masseter, sorry, and the mastoid process and attaching muscles. Now we have the cranial nerves and the vessels. So we have adjacently placed to the styloid process. First we have the 10th cranial nerve. Remember, styloid process, adjacently we have 10th cranial nerve. Again we have the internal carotid artery and the internal jugular vein. Again, then adjacently placed, we have the ninth, the 12th, as well as the 11th cranial nerves. Okay, remember the sequence. First, the styloid process and the styloid muscles attaching to it. Next, adjacently, we have the 10th cranial nerve. Again, we have the internal carotid artery and the internal jugular vein. Again, we have the 9th, the 11th, as well as the 12th cranial nerve placed. We have again the bony relations, the mastoid process, and attaching the two muscles, the posterior belly as well as the sternocleidomastoid. Now, let us talk about the relations of the superficial surface. Superficial surface means what? I have said no, as soon as we reflect the skin and the superficial features which are present, the first thing which you are going to appreciate is the superficial surface. No, so logically, if you think we will be having skin, we'll be having superficial fascia. As discussed, it is supplied by the great auricular nerve, and we have the some lymph nodes which are called as preauricular lymph nodes. And interestingly, we have some structures which are present within the parotid gland. Okay, so these are the external carotid artery, the retromandibular vein, as well as the branch of facial nerve. Remember, the branch of facial nerve. So these are the structures which are present within the parotid gland. Now let us talk about the correct order of structures present within the parotid gland. Once it has been asked in an exam to arrange the order of the structures which are present in the parotid gland. So from superficial to deep, we have the nerve, vein, and artery. Okay, that is the facial nerve, the retromandibular vein, and the external carotid artery. To understand, see, suppose if you dissect the if you dissect a cadaver near the parotid region, first, as soon as you reflect the skin, you see the fascia and all things, then you can appreciate the facial nerve first. After the facial nerve, you can appreciate the retromandibular vein. After that, you can appreciate the external carotid artery. I think you are in pace, right? So these are the relations of the parotid gland. I hope you understood. If you have any doubts, please do comment in the comment section, or you can directly DM us on Instagram. The ID is Mediverse Atlas. So okay, now let us talk about the most important topic of the parotid gland, that is the structures emerging from the parotid gland. Before understanding the structures emerging from the parotid gland, I just want you to recollect that there is a facial nerve which is present within the parotid gland. Now, within the parotid gland, this facial nerve, it divides into 5 different branches. Now let us take a look of those branches. So think, suppose this as the parotid gland and this is the parotid duct. Now we talked that there is a facial nerve. It splits into 5 different branches. So the first branch is the temporal branch. The second branch is the zygomatic branch, and the third branch is the buccal branch, and it is divided into upper buccal as well as the lower buccal. Next, the fourth branch is the marginal mandibular branch, and the fifth branch is the cervical branch. So totally, the facial nerve within the parotid gland, it divides into 5 branches. Those are temporal branch, the zygomatic branch, the buccal branch, again divided into upper as well as the lower. Next, the marginal mandibular and the cervical branch. Now it will be somewhat easy to understand the structures emerging. So accompanying this facial nerve, the branches of facial nerve, we have some arteries and veins. That's it. So now let us talk about the structures that those are emerging from the apex. Now if you see this diagram, you can appreciate that from the apex we have the cervical branch of facial nerve. Along with the cervical branch, we have the retromandibular vein. That is the divisions of retromandibular vein. Okay, next, from the anterior border, that is from this one. So this is the anterior border, this is the posterior border, and this is the superior surface or the base. So from the anterior border, you can clearly appreciate, excluding the cervical branch because it is from apex. Now we have the temporal branch. So the temporal branch, you can clearly see, along with the temporal branch, we have the transverse facial artery. Next, the zygomatic branch, as well as next the buccal branch again, and the upper as well as the lower, right? Next, the marginal mandibular. Simple. We have the transverse facial artery extra added here. That's it. From the anterior border, we have the branches of facial nerve with the transverse facial artery. Next, from the base or the superior surface, we have the superficial temporal artery, superficial temporal vein, and the auriculotemporal nerve. Okay, because from the base we have the vessels emerging to the temporal region. Okay, we have the auriculotemporal nerve, the superficial temporal artery, and vein. So these are the structures emerging from the parotid gland. I hope you guys are clear with this concept. Just remember that the branches of facial now, from the cervical branch extra, we have, what do we have extra guys? We have the retromandibular vein divisions. Okay, next, along with it, what do we have here guys? In the anterior border, we have the transverse facial artery, right? So this is the transverse facial artery. From the base we have the superficial temporal artery. Next we have a superficial temporal vein, and we have auriculotemporal nerve. So these are the structures emerging. I hope you guys are clear with this concept. And let us talk about the arterial supply of the parotid gland. This arterial supply of the parotid gland is by the external carotid artery. Okay, external carotid artery and its branches. Now you can clearly, still more clearly understand the structures emerging. See, so this is the external carotid artery. This transverse facial artery and superficial temporal artery, which are the structures emerging, right? Remember, so these are the structures emerging. These are arising from the external carotid artery only. Okay, interesting, right? Next, the venous drainage, the main, the retromandibular vein. Okay, the retromandibular vein is the main venous drainage of the parotid gland. Okay, now the nerve supply of parotid gland. This nerve supply of parotid gland is, can be divided, can be studied as the parasympathetic supply, the sympathetic supply, as well as the sensory supply. So the parasympathetic supply means the secretomotor functions. Okay, secretomotor functions, that is the parasympathetic supply, it helps in the secretions from the parotid gland. Okay, now the sympathetic means the blood vessels. Remember, sympathetic means it is related to blood vessels, that is the vasomotor supply. Sympathetic is the vasomotor. Sensory is nothing but the providing the sensations. Okay, so the parasympathetic is the secretomotor from which ganglion guys? Remember, very important, it is from the otic ganglion. Okay, the vasomotor supply or the sympathetic supply is from the T1, the thoracic segment of lateral horn of spinal cord. Okay, you can clearly appreciate, if you see a spinal cord, we have the lateral horns, no, like this. So from the lateral horn, from the T1 segment, we have the sympathetic supply or the vasomotor supply of the parotid gland. And sensory supply, we have only two nerves, the great auricular nerve, that is, it supplies the capsule, as well as the auriculotemporal nerve. Okay, I hope you guys are very much clear with this. Now, the last concept of the parotid gland, that is, we have to talk about the parotid duct or the Stensen's duct. Okay, this parotid duct, the measurement is surgical important. Okay, it is thick wall, it has a thick wall, and it is 5 centimeters long. Now the course of this duct is very much important. How is it important? This gland, along its travel, it goes and drains into the mouth. Basically the parotid gland secretes saliva, right? So from the parotid gland, the saliva is drained into parotid duct, and the saliva is drained, the final destination of the saliva is the mouth. Okay, now along with its course, it spears some structures. So what are the structures pierced? Is the first is the buccal pad of fat. The parotid duct, it pierces the buccal pad of fat. Then the buccopharyngeal fascia. Next, the buccinator muscle, and finally it opens in the oral mucosa at the crown of upper second molar. Remember guys, very much important, the upper second molar teeth. Okay, now why is this course very much important guys? So this course, it prevents the air entry into the duct during blowing of mouth. Now clinically we have something called as Freys syndrome. Okay, this Freys syndrome is also called as auriculotemporal syndrome, or the Freys syndrome, or the NTRUHS syndrome. So what is the cause of this clinical manifestation guys? So basically the cause is due to the damage of the auriculotemporal and great auricular nerves in surgeries or accidents. Okay, when they are performing the parotid surgeries, or when there is a trauma, so there will be occurring this Freys syndrome. Now what is the basically the anatomical basis of Freys syndrome? First, the auriculotemporal nerve, it supplies the parasympathetic fibers, which are secretomotor. If you remember, these are secretomotor, right? These are secretomotor. Next, the great auricular nerve, it supplies the sympathetic fibers, which are vasomotor. Am I right guys? Now just think logically, these parasympathetic fibers they increase the secretion. As a sympathetic fibers, they supplies to the sweat glands of the facial skin. Okay. Now, when the damage happens during the regeneration of these nerves, during the nerve regeneration of these nerves, these two nerves, they together grow. Okay. They together grow and causes sweating rather than salivation, which is known as the gustatory sweating. Okay. When these two are damaged, these two nerves are damaged during the regeneration, these together grow and it causes the sweating rather than salivation during eating, which is known as the gustatory sweating. Okay. This is all about the Frey syndrome. The main thing which you need to remember is during regeneration, suppose this is the auriculotemporal nerve, just a rough diagram. This is the auriculotemporal nerve, as well as the this is the, what do we say, the great auricular nerve. Now these two get damaged, and during the regeneration these together grow like this. So instead of salivation, we will be have sweating. So this is all about parotid gland, guys. If you have liked the video, please do share it with your friends, and subscribe to Mediverse Atlas. Don't forget us to follow on Instagram and Telegram. Thank you so much for watching. Bye.